Hi, friends. Dr. Nancy Trimbley, as always, putting the power and knowledge of your health back in your hands. Today, we're talking about vitamin D. What's low? What's good? How do you know? Shouldn't my doctor tell me and then I'm okay? Low vitamin D levels are there's a direct link between low vitamin D levels and severe cases of COVID. And I want to screen share with you because I'm going to show you my blood test from 2019. This is, let's see, there we go. This is my test, and it was taken in July of 2019. And there we go. So you can see in July of that year, my result of my vitamin D was 79.7. And it does say here that the limits, which would be the normal, is between 30 and 80. And these little letters here, NG/ml, that's how they measure it in your blood. Keep in mind, in some research studies, they do use a different unit to measure, so that can be confusing for the average person. But in the United States, when you get a blood test, they're going to measure it in this unit. And if you read through this, it says deficiency less than 20, insufficiency 20 to 29, optimal 30 to 80. This is where you get led astray because optimal is not 30 to 80. Optimal for COVID prevention and for overall body function should be listed as 80 to 100. Toxicity is anything over 100, like 125 would be a bad thing. And here's the other thing. Notice in this abnormal column right here, there's nothing there. That's because all of my results were in the normal limits. Between a low and a high, they were within that normal. If, let's say, my vitamin D had tested at 20, I would have had an L right here for low. And if you get out one of your blood test results that looks like this, you will see an L or an H or nothing. An unsavvy medical doctor, conventional medical doctor, unsavvy, somebody that is not holistic, will just look at this and they will look at one column. They will look at the abnormal. Is there an H? Is there an L? If not, you're great. They went to school for all that time and they don't put the pieces together on the blood tests they get a lot of times. I'm going to circle back to that in a minute. What makes me laugh is that in this crazy COVID world today, if they are not up to speed on vitamin D levels and its relationship to COVID, in my opinion, that is malpractice. And I'm going to screen share with you an article now from Mercola.com. This was just published not even a month ago. The vitamin D supplementation reduces COVID-19 deaths by 64%. In some parts of Europe, in Norway is one example I can think of, the population receives regular vitamin D supplementation from the government. They are very far north. And during the wintertime, they do not get adequate sun exposure to create vitamin D, which is an integral part of the immune system. And I won't go into all the details of vitamin D, but this is a fantastic article that goes in depth to how with severe cases of vitamin D, nearly every single, or in severe cases of COVID, nearly everyone had low vitamin D. So what should your results be? And this is not research that's hidden. This is out there. The researchers in immunology are seeing this. Some of the medical doctors that want to help people and keep them away from severe cases of COVID, that are wanting to use methods to not just send them home from urgent care with COVID and have them face that on their own, but MDs that want to help them to recover and recover fully without long hauling. They know about vitamin D. In the last week, I've had 2 conversations, 2 separate people, 2 different walks of life that said, "Oh, yeah, I got my blood test. I'm at 32. I'm normal, right?" And I'm like, "No, no, bad. You are in danger. If your blood test for vitamin D says 32, you are in danger. Optimal is going to be between 80 and 100. If your doctor ignores this, I consider that malpractice at this stage of the game. So here's my nutritional advice for you. Get your blood drawn and ask for a vitamin D test. In my neighborhood, it costs $65 to do that. When you look at your results, if you are like this test showed for me, I was at 79. That's pretty close to 80. That's really good. And keep in mind, it was July. I was getting a lot of sun exposure. If your readings are less than 80, if they're 55, 65, I suggest you start supplementing with vitamin D and start taking either 5,000 or 10,000 IUs. That's how it should read on the bottle. 5,000 to 10,000 IUs every day. And in 2 months, 3 at the most, get your vitamin D level checked by blood test again. So you can check to see if you're doing the right thing. If your levels are less than 50, however, we're going to need to take some little bit more drastic action. We're going to need to do a load up dose with the vitamin D, which means that for 10 days, you will take 20,000 IUs every day for 10 days, and then reduce to 10,000 and do that for a month, and then reduce to 5,000. And then in 2 months, get your levels checked. If you're finding you're fighting a lot of sinus or colds or things like that, you can take 50,000 IUs of vitamin D for 5 days and then drop it down to 10,000. Stay on that for about 4 weeks and then drop it down to 5,000. Be sure to get your levels rechecked to know that you are reaching that optimal level of between 80 and 100. You've got to be your own best expert in this because your conventional medical doctor, their job is to name disease with a diagnosis and then treat the disease using pharmaceuticals. That's what they do. If you're looking for them to help you with wellness, that's not their job. They may or may not be able to do it. And I teach in my book, Stealth Health, about how you can become your own best expert. I teach you step by step how to figure out you, to unravel the mystery of you. And I also talk about how the system that's in place in the United States, the system has been working against us our whole lives to make us sick. And that includes the food industry, the chemical industry, the pharmaceutical industry, and unfortunately, conventional medicine tags along with pharmaceuticals. Then you've got the media along for the ride. And unfortunately, research sometimes follows that trail. So this system, as I call it, capital T, capital S, has been working against us. So it is up to us to take back our own knowledge and power over our own health so we may get our greatest joy out of life. So I hope that helps. Bye for now.